Hello and welcome to the Connected Community Podcast. I am so excited to offer this 3-part series about the Kambo frog. There's so much information and we couldn't fit it all into one podcast. Today, we're really going to deep dive into the science of Kambo, why it works, what are the peptides, what do they do, medical considerations, and who can benefit from Kambo. I also want to refer you to the last 2 podcasts. We really deep dive so far into this topic. We talk about our trip to Peru, what it was like meeting the frog, collecting its medicine, where the different points are in the body where you can put the gates. We talk about the quality of the purge. There's just so much. So I hope you'll enjoy this series, and I want to thank you so much for being here today. Hello, and welcome to the Connected Community Podcast, a place to explore possibility through mindfulness, movement, and self-discovery. Our intention is to deliver insight and inspiration while fostering conversations that are genuine, unfiltered, and deeply human. We hope you will enjoy today's episode. Hello, Adam. Welcome to the Connected Community Podcast.
Hi.
I'm so excited to have you. This is a 3-part series. And so now we are going to go into the science behind Kambo, the contraindications, and all of that juicy stuff. I just quickly want to talk about the last 2 episodes for the people that might not have tuned in. These are so comprehensive. That's why we're doing 3 sequences of this. And we really talk about everything around Kambo, the spiritual aspects, the physical aspects, the purge, the water consumption. We talk about what it's like to capture the frogs because we just came back from Peru. And the main reason that we went to Peru was to go and to meet the frog and to make our own sticks and to get the medicine. So we talk about what that process was like, capturing the frogs, making our sticks, getting the medicine, what the different methods of application are, to do it dry, to do it wet, to do it straight off of the frog fresh. And they're just packed full of information. So for people that haven't tuned in to those, I would encourage you to do so. And today we're going to dive into the science. And I'm super excited to have you doing that because I'm definitely not the eloquent speaker on it. I know a lot about it, but you have the medical background. So, and for people that don't know, you're my husband, and you're also, we just did I did a 10-day Kambo training in the United States, and then we just came back together and we did a 5-day really comprehensive one in the jungle with the indigenous people and like hunted the frogs. So let's dive into a lot of this, but please tell people about your background with Kambo and also your background in the medical profession.
Yeah, so I've been doing Kambo for about as long as Nikki's been doing it, so maybe a little over a year. And a lot of my familiarity with it has been through your training that you did with Tribal Detox, but also looking into the science of it on my own. I'm very curious about how Kambo works and what sort of the physiology behind it is. So for people who don't know, I'm a pediatric nurse practitioner and I work in the pediatric ICU. So physiology is definitely one of my hobbies, if you want to call it. And I tend to kind of geek out on it a little bit. So I'm going to try my best not to make this a medical lecture for those of us who are non-medical, but I do want to go into a little bit more of kind of how Kambo works on a physiological level, how it affects the body, and why you experience the things you experience when you sit with this beautiful and really powerful medicine.
Yeah, and I also want to add that you're back in school to become a psychiatric nurse practitioner. So there is this big element for you around like love and understanding of the social, emotional, spiritual aspect. And so you're not just in the medical, but you're kind of in that psych world as well. So yeah.
Yeah, and I think Kambo has a lot of untapped potential for mental health, which we'll kind of get into a little bit. There's a lot of gut-brain connection that is super important when you're discussing what the causes of depression are. And since Kambo is so effective in working with the gut and the gastrointestinal system, I think there's a lot of potential, and hopefully there'll be some studies on how Kambo can be effective in the mental health world.
Yeah. Yeah. And I know we touched on this at the last episode, but the Phyllomedusa bicolor is the Kambo frogs. It has a lot of different names. It's from the Amazon basin, and we use the secretions of that frog through what we call gates, or we do superficial burns on the body. They don't bleed. It's not something that's painful, and that's how the medicine enters through and gets into our lymphatic system. So that's the application. There's some people say it's like a frog toxin or a frog poison. I think it's a frog medicine. It definitely feels a little bit like a poison or a toxin when you're taking it, but then the next day there's like all of these benefits that come from this medicine. And I always say there's a reason that people keep coming back to it over and over and over again. If it didn't work, people wouldn't be coming back to it. And there's a lot of science and data behind it. And I know you and I are a little woo and then like super logical and practical and grounded in science. And that's what I love about it, is that there is a foundation for this, and it does have a background, and there are a lot of studies about the peptides and why it works. So it's not something that's woo, although it sounds like, oh my God, we're going to put frog poison over these burns in our body. That sounds insane and crazy. And if you listen to our last episodes, we talk about what it's done for us personally, what it does for other people. And it does have like a social, emotional, physical, spiritual element to it, all of it wrapped in. And what I love about it most is it's got all these peptides and all these things that it does for us, but it seems like it just kind of goes where it's needed. And so it cures a ton of things. And so let's talk about why somebody would come to Kambo. And I know, and that's such a loaded question, because people can come for depression and PTSD, but then they can also come for like physical pain and things like that. So what are some of the things that it has been shown to be effective for?
Yeah, so I'm going to try to not go too geeky on the peptides. I think what I should first sort of point out is, what is a peptide? Peptide is a short chain amino acid. So all of our DNA is coded in these like little codons, essentially, the little letters. And those little letters are also then created into like we call messenger RNA. And those little proteins, those little peptides have a specific code that tells our cells how to do what our cells are supposed to do. So it's how our body communicates with the tissues, the cells, and largely our organs. And so we're talking about organ systems. Note that this is happening on a cellular level. Those peptides are entering our bloodstream through our lymphatic system, and then they're going to where they need to work. And they're telling those systems, those cells, those organs, how to do their job more effectively, more efficiently, and kind of resetting or regulating systems that may be out of balance. So that's just like a very broad kind of understanding of what we talk about peptides and how they work.
Well, let me interrupt you really quickly, because one of the things that Jason Fellows is who ran Tribal Detox was saying, and in my brain of like how I understand that too, is that the like over time through taking antibiotics and taking medications and all of the pesticides in our food and environmental toxins and aging and all of these things, our cells start to break down and not perform optimally. And so what Kambo does and those peptides does is it goes and it's those signaling molecules that tell the cells how to perform optimally. So we feel afterwards when we've done Kambo that like we're a new person, or and it's not that we're a new person and it's done all this for us, but that's really like how we're supposed to function when our cells are performing optimally. And so I'm wondering if that is an accurate statement.
Yeah, I would say so. As the body ages, it accrues what we call oxidative stress, and that causes damage to the DNA of your cells, and that damage then prevents those cells from functioning properly, or it may cause them to send signals that are maybe not adaptive or maybe irregular or incorrect for what they're supposed to be doing. And so you do tend to find that as the body ages, systems start to function less efficiently, and sometimes they don't work at all.
Yeah.
So there is this sort of natural lifespan of a cell, and as it gets older, it stops working the way it's supposed to.
Yeah. Okay. So let's jump into what are some of the things that Kambo helps with?
Yeah, so I mean, these are really broad categories, and the way we know what Kambo can do for us is the study of these specific peptides. And so, Kambo, as a secretion, as an organic compound that the frog produces, has a lot of peptides in it, probably more than we've actually been able to isolate and study. But what's interesting about Kambo, opposed to other kind of natural or plant medicines, is that there's a lot of interest in the pharmaceutical industry in isolating these peptides, understanding them, and hopefully using them to create products, medicines synthetically that then they can sell, patent, copyright, and market to people for various reasons. And so there's a lot of interest in that because of the money that might be behind it. But that also means there's a lot of actual clinical studies about how it affects the body. And so we have a lot more information about Kambo than we do, say, like how psilocybin mushrooms work or how other potentially like psychoactive or plant medicines. So there are about 13 main peptides that have been studied from the Kambo secretions, and I'm going to try to not go into like every single one of them, but just sort of broad strokes. Some of the big ones are the Phyllomedusa, just the name of the frog. It's where it gets named from. And then phylloquinin are kind of the big kind of main categories. And within these, there's also other ones we call bradykinins or tachykinins. And that's just a fancy term for a chemical or a peptide that creates some of the effects that you feel, specifically the changes in your heart rate. So tachykinins make your heart rate go really fast. And then bradykinins are responsible for a whole lot of inflammation and what we call vasodilation, meaning the blood vessels in your body start to kind of widen and open up, which causes your blood pressure to drop. And so a lot of the symptoms that are uncomfortable with Kambo can be related to the tachykinin and bradykinin chemicals or peptides that are in the Kambo secretions. So we can go into more of that when we talk about the things that you feel when you sit with Kambo, but those are kind of the two big ones. And then the other main thing that you feel often is a lot of discomfort in your stomach, in your gastrointestinal system. And that's because the Phyllomedusa and some of the other peptides that are in Kambo are incredibly active on the smooth muscles of the gastrointestinal tract. So it also causes a lot of release of secretions in the stomach, the pancreas, the gallbladder, the liver. And so there's a sort of like pumping action that's occurring in your whole GI system. And so it's almost like a flush out of a lot of the major organs and things that are involved in your digestive system. And so this is why when we talk about the vomit that people have in Kambo, you can kind of look at it and help kind of assess what might be going on with your health or your diet, things that might be something to look at. And so there is something behind what comes out when you do purge with Kambo, and that's related to this pumping and kind of cleansing action of the GI system.
Okay. Yeah. All right. I'm going to bring you back to
Yeah.
what are some of the benefits, right? And so I know like it's good for people with autoimmune disorders, one of the best things. It's good for Lyme disease. It's actually one of the most effective things for Lyme disease. It's great for fertility, for helping with fertility. It's with PTSD and depression. What are some of the other reasons why people would come? I think it helps with like low energy, with anxiety, with like, let's name some of those
So those
things.
are really broad things. I'll kind of break it down a little bit. Sorry, we're going to geek out a little bit. So a lot of the peptides, specifically the dermaceptins, have broad antimicrobial properties, meaning they're both antibacterial, antiviral, antifungal. And so a lot of people will use these, especially traditionally in the jungle, they'll use it to fight infection. And there's been a bunch of studies that have been done in the Western medical world around its carcinogenic properties. And so when we think about how we treat cancer and we try to treat tumors, is that we use these medications that are really kind of broad in terms of affecting cells that grow rapidly. And so they affect a lot of healthy cells as well as the cancer cells, and they can have a lot of really negative side effects. The cool thing about Kambo is it's actually very selective specifically to cancer cells, and so has far less side effects than typical chemotherapy. So I think there's a lot of interesting information that's going to be coming out about the potential for Kambo to treat cancer, which I think is super exciting. I want to go back a little bit and talked about how it affects the GI system. And so one of the organs that's involved in that is the pancreas. And so it can actually help increase stimulation of insulin. So it can help with like type 2 diabetes. And so it has kind of anti-diabetic activity, which is super cool. One of the really kind of neat things about, because it is so active in the GI system, is that it potentially can help affect causes of depression or mental health issues, it might be related to gut health. And so there's this connection between gut and brain that's sort of cutting edge science right now. And I think Kambo definitely has a place in treating treatment resistant depression and looking at some other things that might be hard to treat with our current psychiatric therapies, essentially. It's got implications in Alzheimer's, Parkinson's. A lot of this hasn't been studied at great length, but there's been a lot of kind of curiosity and interest in these different areas. One of the things Kambo does, which is a totally different system, is it affects a lot of our endocrine system. And so things like osteoporosis or osteopenia, so like low bone density, it actually inhibits calcitonin. So it decreases the destruction of bone and helps kind of make your bones stronger, which is super cool. One of the other kind of big things that Kambo can do, and I mentioned bradykinins, those are these little like peptides or chemicals that cause inflammation. And so what's interesting is that actually Kambo is really effective against autoimmune and inflammatory disorders. And I don't think we fully understand why that is, because it's sort of intuitive. You've got a medicine that causes inflammation that's used to help fight inflammation. So it's a little bit of a paradox, but I think one of the ways that actually happens from like a physiologic standpoint is that you have these adaptive systems that come online when you stress the body. And so you're causing this low level of stress to then kick in the natural adaptive systems in our body to then help fight maybe chronic or kind of overactive inflammation or autoimmune processes. And so this effect's been called hormesis. People may have heard that word before. Essentially, it's this like stress or like adaptive response to stressing the body. And so a lot of the benefits of Kambo come from the fact that it is really hard to sit with and does cause this kind of stress. But that stress then kicks in all these natural systems to help regulate and kind of calm down the nervous system, our endocrine system, and a lot of other things. So it's super cool.
Yeah. And I also think it's really interesting because it helps with fertility, yet if you're pregnant, it can create a termination of pregnancy. And if a woman's lactating and they do Kambo, it can dry up their milk. So I love that kind of twist on what it does in that way.
Yeah, I'll break that down a little bit because there's some cool science behind that. One of the things that Kambo does is it actually decreases the production of prolactin, which is the hormone that's responsible for breast milk production. So that increases after you give birth to allow a woman's body to produce breast milk. And so if you wanted to dry up your breast milk production, you could do Kambo and that would stop that process. We talked about how it activates smooth muscles in the body. So smooth muscles are not just in the GI system, but they're also in the GU system. And so the uterus has a bunch of smooth muscle in it, and it causes contraction in the uterus. And so one of the things that can happen when you sit with Kambo is you can get a lot of discomfort down in the womb area for a woman. And so if you are pregnant, this can induce labor, those contractions.
In the later stages, on the much later stages, yes.
Yes, if you wanted to induce labor, it's something that you could use. It's what in the jungle they traditionally use it that way. But one of the problems is if you're pregnant and it's too early for you to give birth, it actually could cause like a preterm labor or potentially result in abortion, which it's also been used traditionally for that as well. The way it affects your fertility is it actually acts on your stress system. So it affects your adrenals and it actually helps regulate the production of your hormones that are related to fertility. And so it has a lot of different uses. And I think we say kind of what it does at a broad stroke, but the nitty gritty of it's super fascinating because when you break it down, you can actually go, oh, that's how that's working. That's how this is working. So super cool.
What about the connection with the blood-brain barrier? Because what I've heard is you want to do Kambo 24 to 36, 48 hours before a psychedelic journey, such as ayahuasca, such as psilocybin, any kind of psychedelics, because I've heard it makes a smoother, cleaner. I kind of think it opens up the blood-brain barrier, but then there's also this piece about like clearing out the body and cleansing out of the system before going into a psychedelic journey. So I'm wondering if you could speak about that.
Yeah, so I think that's related to the bradykinin action of the peptides. And so anything that causes inflammation, and this actually is able to cross the blood-brain barrier, which is really interesting. For people who don't know what that is, there's basically this kind of like impenetrable perimeter or border of cells that protect the brain from being exposed to all things that are in the bloodstream. But there are certain either small molecules or things that actually are able to cross that barrier. And Kambo, the peptides in Kambo are one of those things that can do that. Because of the bradykinins, the inflammation that it causes, it actually kind of opens up those channels to allow more things to kind of move across that barrier. So potentially there could be some risk involved with doing that, but it seems like with Kambo, where it's used traditionally, a lot of times is prior to an ayahuasca ceremony or other medicines that you want to more easily cross the blood-brain barrier, so that they're more effective and you have a bigger or more intense experience. And so it can definitely be used in that regard as well.
Mm-hmm. Is there anything that we haven't touched on about who could, I mean, I think everybody can benefit from Kambo. I have for sure. And I pretty much started out very healthy. I felt like for me, it was a nervous system reset. I got tons more energy. I felt really good in my body. I felt different in my body. And I didn't realize I had brain fog until it lifted. And then I realized, oh my gosh, I had brain fog this whole time. So I think for the average person, it can be really helpful. But are there any other conditions that it can be useful for that we haven't touched on?
Yeah, two more that come to mind that we haven't touched on. One is for like chronic hypertension. So because it does such a
Oh,
potent
yeah.
vasodilator, it
Yeah.
actually helps reduce your blood pressure. So if you struggle with hypertension, it
Mm-hmm.
can be beneficial for that. The other one that we didn't touch on, there are two peptides specifically that are essentially opioid receptor agonists, meaning they act on the opioid receptors in the body.
Yeah.
So things like morphine, fentanyl, these are drugs that are very strong opioids. Well, there's two peptides in Kambo called dermorphin and deltorphin, and they're actually like I think they're 4,000 more potent, 4 times more
Yeah.
potent than morphine, which is fascinating. And I think a lot of the
Without the
information
analgesic effect.
no, they analgesic meaning they actually help with pain. Yeah,
Okay.
that's the effect that we want from them. They don't
Okay.
have anesthetic effects. So
Yes. Okay.
yes, they don't make you sleepy. Yeah,
Yes.
and so I think some of the pharmaceutical companies have been looking at these two peptides to see if they potentially could be used clinically
Mm-hmm.
in medicine so that they actually help with acute, maybe even chronic pain
Yeah.
without some of the side effects like respiratory depression or sedation that other opioids have. And so
Yeah.
they can be very effective in treating acute and both chronic pain or conditions where there's
Mm-hmm.
inflammation that maybe is also contributing to chronic pain, like things like gout or arthritis, things like that. Or if you've got like an acute injury, it can help a lot with swelling and inflammation as well.
Yeah, there's been so many successful stories of people with chronic pain that have been helped with Kambo. And I just think of two that come to mind really quickly where my friend had a wrist injury and her wrist was killing her. And then in the middle of purging Kambo, she realized that she'd putting her full weight on her wrist and it didn't hurt. And it didn't hurt after that. And I've had people come to me where they've had really intense back and neck pain for months, 6 months, a year. And then after the combo session, it's gone and it's gone for a really long time. And that's what I'm saying is really neat is that it just goes to where it's needed in these different systems and works in that magical way. And then I also think that it is really effective against inflammation and autoimmune. And I feel like almost everything that we have is a contributing factor to that in this world right now with our diets and with everything else. We have so much inflammation, and so it's great for that.
Yeah, I mean, there's a lot of data that's coming out suggesting that depression is actually an inflammatory disorder, not actually like a mental health, like
Mm,
just in the mind. It's actually the body. It's like an inflammatory process that's causing
yeah,
depression. So if you think about it in that regard, it could be a really potent medicine for a lot of reasons.
yeah, yeah.
Yeah.
All right, let's talk about contraindications. And why I think that this is so important is, I got trained in tribal detox. That was super comprehensive, one of the most comprehensive trainings in the country, I would say in the world. And then we got trained in the jungle, and it's a very different style. What happens is in the jungle, people, indigenous people aren't coming in with the same issues that Westerners are coming with. And as I've been practicing combo and serving that for a while, I would say 9 out of 10 people that come to me are on a plethora of medications. And this is not something that the indigenous tribes have to deal with. And so there are a lot of contraindications, and it's really, 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 really important if you go to a practitioner that they ask you all of these questions, they get a health history from you, and they look at your medications. And yes, we are not doctors, we're not prescribers, we're not medical professionals in that way, but I think that we have a responsibility to look at people's medications. And I know through my tribe and in Tribal Detox, I have a whole group of people that I can run all of these scenarios through to make sure that it's safe. And I have you, which I run almost all my clients and all their medications through you to make sure that it's safe, because there are contraindications with medications, and you can't just get a stick. And I think self-administering this is super dangerous. I don't think it's a good idea. I think microdosing it or self-administering it is a horrible idea. There is a possibility that you can pass out and vomit and die. It doesn't happen very often, but as I am trained as a practitioner, I know how to self-administer safely, but I still do it when somebody else is around because I want to make sure that nothing happens. And it's really important to look at medications, and you don't want to just stop your medications so that you can go on Kambo. And so we'll talk about the medication piece first, and then we'll go on the contraindications, because I was always taught to look at what the medications are, look at if they're contraindicated, and then look at half-life times 5. And people don't even know what half-life times 5 is. I didn't. And I think it's really important that the morning of your session not to take your medications just because you might vomit them up. So let's talk about the medication aspect and what we're looking at, because it's like low blood pressure is super contraindicated, but high blood pressure, it's very good and effective. And then some people have low blood pressure, but they're not on medication. That's fine. But if they're on a medication, it's not. So let's just talk about the medication aspect for now.
Yeah, I think really briefly. So you talked about half-lives of medications. A half-life is basically how long medicine's in your system before half of it has been eliminated. So with every half-life, there's half of less of it in your system. So anywhere between 4 to 5 half-lives is enough time for medicine to basically be out of your system. If you take a medicine that has a half-life of 10 hours, it's going to take anywhere from 40 to 50 hours for it to be out of your system.
But a half-life is, okay, sorry. If I take a medicine and it lasts for 10 hours,
yes,
then what is the half-life of that medicine?
You have to look it up. So a lot of this is complicated. It requires a lot of information that you have to look through, like a drug formularies for, to get the pharmacokinetics.
I always look it up on the web, but I thought it was half. So I thought if a medication lasted 10 hours, then a half-life was 5 hours, and that would be times. No, okay.
No, it has to do with how it's metabolized and eliminated in the body. So things are cleared by the liver, things are cleared by the kidneys. So things get excreted in different ways. They get broken down by different enzymes in the body. And so in order to understand that, you probably have to have a medical background, frankly, or have access to drug formularies and information that actually look at what they call the pharmacokinetics of a drug. So
yes. But we looked at, as practitioners, I always look that up. Like, what is the medication? What's the half-life times 5? And then I kind of run it past my tribe, and I run it past you. And this is the reason why it's important not to self-administer. And this is why it's important to go to somebody that's actually trained. I think Western trained is really important. I think there's value in being trained in the jungle for sure. But I think being comprehensively trained in the West is so important for this reason.
Yeah, and I guess what I'll just say briefly is that, so stuff like SSRIs, things that are long-acting meds that take a couple of weeks to become therapeutic, often have half-lives of like a week. And so you're talking about coming off an SSRI completely, you're looking at like a month. If you've been on it for a long time, that can cause withdrawal symptoms, or I would call discontinuation symptoms. And so it can be kind of dangerous to just abruptly stop medications. And so if you are on any of these longer acting medications or medicines that have potentially side effects to come off of, it's not something that you should do by yourself. It's not something you should actually even do with the advice of a Kambo practitioner. It's something that you should really go to your medical professional that is prescribing these medications to talk to them about how you might either wean off of it, or if you want to reduce your dose, and kind of discuss if it might be safe to sit with Kambo based on the medications that you're taking. And what I'll say briefly about that, because I'm not going to go through individual drugs here, but anything that affects either heart rhythm, heart rate, or has a lot of changes in blood pressure are kind of the things you have to be the most concerned about because of the way Kambo interacts with the heart and the cardiovascular system.
Mm-hmm.
And so that's just like broad stroke, sort of the areas you have to look at. And unfortunately, most medications that are used for psychiatry, for mental health,
Mm-hmm.
have, because they are such, I'm going to call them dirty drugs, meaning they have a lot of side effects and they affect a lot of different systems of the body. They're the ones that are probably the most complicated to work with. And so it doesn't mean you can't sit with Kambo, but it does mean you need to have a really like frank conversation with your provider that's prescribing them and figure out with your Kambo practitioner which medications might be safe to continue, which ones might be ones you just don't take that morning of, or which ones you need to actually wean off of
Mm-hmm.
prior to sitting with Kambo.
And it can alert your Kambo practitioner about how to administer. So there is this thing called low and slow, where we do a really low dosage. We could do a diluted one. We could do a half dose, a half dot, and then layer them on really slowly. And so people that are coming to us in those ways, then we can monitor them really carefully and do it really safely. So it's always important to disclose medications anytime that you're working with Kambo.
Yeah, and there's a couple of drugs that are like strict contraindications, and those are anything that I call immunomodulation. So they affect the way the body reacts, the immune system reacts to itself. And so people who are on medications to tolerate like an organ transplant, they should not sit with Kambo.
Mm-hmm.
People who are on really serious autoimmune drugs need to have a really frank discussion with their medical provider about whether it's safe or not to come off that medicine and how that interaction with that drug and Kambo might not mix well. And then anyone who's receiving chemotherapy or radiation needs to wait 6 weeks before and after Kambo before
Mm-hmm.
they are administering those therapies. And so those are
Mm-hmm.
like strict, hard, do not pass go
Mm-hmm.
medications.
Yeah. And then there is contraindication around like serving somebody with schizophrenia or bipolar, right?
I mean, I think this is where you get into a little bit of the gray area, right? Again, even though this medicine's studied from a physiological level and a peptide level, how it interacts with people in vivo, meaning like in their body in real life, there aren't clinical trials that look at that. And so if someone does have a severe mental health history, it doesn't mean that they can't ever sit with Kambo, but I would really evaluate it on a case-by-case basis. And a lot of
Mm-hmm.
times, patients who have severe mental health concerns are also going to be on medications that don't play well with Kambo. And
Yeah.
so
And that's
it's something
probably
to
the
think about.
bigger issue.
Yeah, exactly.
Yeah. So heart issues, blood clots, low blood pressure, pregnancy,
Yeah. So,
after surgery, you don't want to be on antibiotics, you don't want to be actively sick.
right. So there's some reasons why so any condition of the heart, whether you've had like surgery or you have, say, you have a pacemaker, you have history of congestive heart failure, fluid overload, any kind of heart operation or heart condition should be a pretty hard no. And depending on what it is, again, that's a conversation between like your medical provider,
Mm-hmm.
the Kambo practitioner, and really evaluating the risk benefit of that. But I would say it's something to avoid.
Mm-hmm.
If you have low blood pressure, it's not that you can't sit with Kambo. It just means that you're going to have more of the side effects of the hypotension that happens with Kambo. And so if you try to stand up to go to the bathroom, you might have what they call orthostatic hypotension, where you pass out
Mm-hmm.
or have like a syncopal episode. So it could be dangerous to stand or move when you are sitting with Kambo.
Yeah.
So that's something your practitioner should know and be prepared to handle. If you do pass out, do you want to touch on how to handle that? Because that's something you learned about.
Yeah, well, I can go through what a typical Kambo arc looks like, but I just want to finish up kind of this piece of it about if there's any other contraindications. I know Addison's disease is one. Like I said, like being on antibiotics or being actively ill or coming out of surgery, like you don't want to do it right after a surgery.
Yeah.
You want to be careful too if you have stitches in certain places because it's really hard on your body if you're vomiting or if you're purging. What are some of the other
Yeah.
contraindications?
So Addison's disease is a disease of the endocrine system. And so it affects your body's ability to react to stress. Your body has like a normal stress response. When there's anything that's stressing out your body produces natural stress hormones that help kind of regulate the system. In Addison's disease, you actually don't have the ability to do that. So you have to take steroids to help protect your body when you are sick or you have a stress to the body. Anyone who's got adrenal insufficiency, it's the same problem. And so you actually could go into what they call an Addisonian crisis, which could look like hypotension, shock, hypoglycemia. It could be like life-threatening. You talked about blood clots. That's one of the things that potentially could cause issues. Kambo actually inhibits clotting. And so anyone who's got any active bleeding in their body, so if you have say you have like a head bleed, that's like a chronic thing, that's something that could get acutely worse with Kambo. Anyone who has a stroke history, whether that be a clot, like ischemic stroke, or what we call hemorrhagic, meaning a bleeding stroke, is probably not someone who should sit with Kambo. And for that very reason as well, if you know you have an aneurysm, the fluctuations in your blood pressure could actually cause that aneurysm to burst. It could cause a head bleed. It could cause you to die. Again, things you shouldn't mess with. Epilepsy is another one of those. Because there is that effect of stressing the body during Kambo. If you have epilepsy, it can reduce the person's threshold to have a seizure, so they could actually cause them to have seizures. And then you mentioned anyone who's got any kind of healing that they're going through, like a surgical procedure or any like serious injury. It could be potentially too hard on the body or cause bleeding or could affect the body's ability to improve. One of the ones that's listed, which I think is interesting, is Crohn's and IBS. And because it's an autoimmune and inflammatory process, I actually think Kambo could be beneficial
Low and
in people
slow.
who have Crohn's and IBS. Yeah, but that would be one of those things you'd go low and slow with, knowing that because it is so active in the GI system, it could potentially cause a lot of discomfort, bleeding, things that you want to be careful of. And then one of the ones that we talked about in the vomiting, one of the previous episodes, is if you have an active peptic gastric or duodenal ulcer, it could cause more bleeding, and the purging that happens during Kambo could actually disrupt that tissue and cause worsening bleeding, which could definitely be dangerous. And so those are the ones I think that are like the big
Well, yeah, there's
points of
also,
concern.
you don't want somebody to come in that's been using drugs or alcohol. And so you need to talk to your practitioner, because if you're a light user of alcohol, then you only need to be free of it for a couple of days. But if you're a heavy user, you need to be free of it for longer. And then if there's any psychedelics or any drugs that you're using, it's really important, really, really important that you disclose that to your practitioner, because all of them have different lengths of time that you need to be free of those drugs before participating in Kambo.
Yeah, Bufo is one of those. I don't know if you want to talk about that one specifically.
So Bufo, and I don't want people to hear this and then go do Kambo. So if somebody's ever done Bufo, you want to wait. It's 4 weeks, but like closer to 6 weeks after Bufo to do Kambo again. You can do Kambo right before Bufo. That's fine. But after, and what it can do is it can throw you back into a Bufo experience for hours and hours and hours. And I know people might think that that sounds like an amazing idea, but it can be really intense and pretty awful. And so, and that's not something that's widely advertised around Bufo, but it's really important to wait 6 weeks after Bufo before you do Kambo. And there's I don't want to get super into this, but there is a danger in overusing Kambo. And the reason I don't want to go deep into it is it's more likely to affect practitioners, because practitioners are using the medicine so much more. And that's mast cell activation. People can look that up. And the reason for that is once that becomes activated, then you have to take a year off of using Kambo. So use it wisely. It's a medicine. You don't want to overuse any medicine. And I'm wondering if you have anything to add to that.
Yeah, I think anything that causes the body to have an immune response, you're kind of training it and triggering it to remember it and respond to it. It's how our body is actually able to protect ourselves from like infections and things that would severely impact our health. And so Kambo, because it is this medicine that's not part of our natural system, the body can begin to recognize it as something foreign and something to attack or protect the body against. And so you mentioned mast cell activation syndrome, MAS. What that basically looks like is like a really severe, really rapid allergic response, allergic reaction, essentially. And so that can cause issues with your airway, with breathing, with hypotension. And so it's something to just be mindful of. Like anything, you don't want to overuse it. One of the things I want to go back and touch on real quick is you mentioned alcohol. And I think people could actually use Kambo as a way to kind of clean out their system and flush those toxins out.
Mm-hmm.
It doesn't mean you can't sit with it. It just might mean that sitting with it might be a lot harder for someone who
Yeah.
is using alcohol heavily versus someone who maybe is a casual drinker.
Yeah. Yeah. So let's talk about the average normal arc of a combo session and what people might expect to experience, because I think it's really important to know what might come up. And not that doesn't mean all of it comes up. It definitely doesn't. But then when it does come up and you've heard about it, then it's not so scary. And I think the first time when I took it, I wish I would have known a little bit more about what are the things that might have come up for me. So in a typical combo session, your practitioner is going to use like unscented incense stick or an actual stick of vine to put superficial burns on your body. They can go in a lot of different places. And what I think is interesting is in the jungle and in the indigenous cultures, the men tend to have it on the arms, the women tend to have it on the ankles. But what happens is the medicine is applied into those burns, into those gates, and usually start with 3 to 7. But again, if somebody's got some of these issues, then we would start with 1. We'd start with a test dot, see how they do, especially that first time. And then we would start to slowly apply the medicine. What happens is within 30 to 90 seconds, the body experiences this flush. And what's interesting is the practitioner, the person that's facilitating it, can always see it before the client. So I'm like, oh, you're feeling flush? And they're like, no. And then a second later, they say, yeah, oh, yeah, I feel the flush. And some people like that feeling and some people don't. But it's like this warm, flush body sensation that comes over your whole body. And it can be pretty intense and it can feel like a lot of heat. The thing that I think is the most disconcerting is the elevated heart rate. So an average heart rate is 55 to 65 beats per minute. And when you take the combo, instantly it goes from like 90 to 130 beats per minute, which you're not exercising. That's something like jumping, running out to the car, the driveway, and then running back. And so your heart rate is pretty elevated. It feels like you're exercising, but you're not moving and you're sitting still. And so it feels really intense and it can create a lot of anxiety and feel really overwhelming. So just knowing that that's going to happen. And even as I say that first time, it feels like your heart is pounding out of your chest and it can be really uncomfortable and a little bit frightening. But knowing that that's coming and knowing that that's short-lived will help that experience. You might feel some pressure in your head. You might get buzzing in your head, tingling in your lips. Sometimes people feel like their throat is slowly starting to close up, but we always say you can breathe. That might be hard to swallow, but you can breathe. You might feel what I noticed, which is really interesting, is people's fingers and toes turn blue. And if you look at it, it just looks crazy and alien like, and that's normal. They might get really cold, they might turn blue. So you might have all these sensations in your head, pressure, buzzing, tingling, things like that. And then you might get tetany, which they call it those crab claws, where you get contraction in your hands and in your forearms, and it can be a little bit painful. All of that stuff that I just brought up only lasts like the first 3 to 7 minutes. So you just breathe through it. And in my training, Jason would always say, like, the breath is your seatbelt. And it really is. Like, if you can breathe and surrender in it, it makes it a lot more easeful experience. Otherwise, it can be really intense and really overwhelming. And so just breathe through and know that that is temporary. After that, then there is a drop in your blood pressure and a slight drop in your blood pressure. And that's when the flu-like symptoms come on. And that's where it can get really intense. That can be where people start to purge, either the north purge out of their mouth or a south purge. But I've seen a lot of people start purging within 30 seconds, within a minute, and they purge the whole time. Some people don't purge at all. But that's when the purge is most likely to happen. That's where you might feel body aches, you might feel pain. I get like temperature changes where I get really hot and then I get really cold and I'm really uncomfortable. You might feel faint, you might feel dizzy, because that's when your blood pressure drops. If you need to go to the bathroom, it's really important that your practitioner has you stand very slowly, stop, take 2 or 3 breaths. They support you to make sure if you fall that they catch your head, and that's what we're trained in. We practice that a million times. I can support a 250-pound man and make sure that he doesn't fall and hurt his head, right? Crack his head open. At that point, you can also crawl if you need to crawl and go to the bathroom, but that's the most likely place where you can pass out. And so that's where you want to be most cautious. And this whole experience lasts, say, 20 to 30 minutes. And after that, I would say within 15 minutes to an hour, you start to feel like yourself again. I find that some people feel superhero energy that day. Most of the people are pretty wiped out after the experience. They need a nap, they need to rest, they want to lay down. It's not until the next day. You're not going to feel the effects of Kambo that day. You're not going to notice some big, huge shifts. You might not notice, like some people have expectations that it's going to be like you're going to wake up and you're going to feel like a totally different person. You really need to tap into yourself and look at your energy levels, look at your brain fog, look at your clarity of thought, look at your mood, look how it feels sitting in your body. Sometimes it's more subtle. And if you're not in tune with your body and you're not kind of checking in with your body often, you might not notice it as much. So it's really important to kind of tap in how you're feeling before, set an intention, get really clear on that intention of why you're even there. And then the next day and over the next couple of days, notice how your body's feeling and notice those shifts. For me, it was dramatic. It's why I came to this medicine. It's why I serve this medicine. It's why I continue to come back to this medicine over and over again. I can feel when I'm needing to come back to the medicine. For me, it's about 5 weeks where my body starts to get misaligned and my nervous system gets to be a little bit wrecked. Just things feel a little bit off. And then I find like, oh, I need to go back to the medicine. Some people go once a month. Some people come every 6 months. It's different for everybody. But that's kind of like the arc. There are other things that happen that are less common. You can lose your vision, and that can be super scary. There's other things, but I'm like, if somebody is in a session with me and that happens, I can just say, hey, that's normal. Just breathe through it. It's going to pass in a minute or two. If somebody does pass out or faint, they usually come back within 15 to 30 seconds. So it's not something to be super concerned about. If somebody starts having a fit, as a practitioner, we're trained to put them in recovery position and what to do in those circumstances. So yes, it's easy to burn a hole and to put medicine into ourselves and into other people. But it's like, how do we handle the medications? How do we handle when somebody's having an abnormal reaction? What are we looking for? We're looking for rashes. We're looking for like if they're in extreme pain, if they're passing out, what to do when they pass out. And that's why it's really important to do this with somebody that's experienced, it's somebody that's trained, we're CPR certified, things like that. So we know how to handle it. And we also know when to call, when is it an emergency, when is it not an emergency. And I want to say it is very unsafe to do Kambo in the middle of an ayahuasca series. So a lot of people go to these retreat centers, they do ayahuasca, their electrolytes are depleted, they've been vomiting, their body's depleted, and then they get that hyponatremia when they do Kambo, and that's the most dangerous. So it's really important your practitioner knows how much water to take, when to take it, not to take too much, and all of this. And so it's not a medication to take lightly. It's not like microdosing psilocybin. It can be dangerous, but it's super safe if it's done correctly. It is such a safe medicine. You just need to know what you're doing, and you need to have faith in your practitioner and know that they know what they're doing. So look at where they're trained, how long they've been practicing, how many people they've served, what was the training that they did, and are they asking you your intention? Are they asking about your medications? Are they asking about all of these other things that are important? Are they really talking to you about the water intake, which is the most important thing? So that's my little spiel on it. I'm wondering if you have anything to add to that.
I do. I was going to interrupt, but I thought you're on a roll, so I just let you go. One of the things that you didn't mention is that you can have throat swelling,
Yeah.
and so it can feel like you have difficulty swallowing. But what's actually interesting is that it doesn't affect the airway, and so you can still breathe even if you have that feeling of tightness in your throat. But one of the reasons why you don't apply dots to the throat or along the jugular is that it could potentially cause swelling of the airway if they're placed in this location, and so that's definitely an area to avoid placement
Mhm.
for that very rare but very serious side effect that could occur. If someone does lose their vision or maybe their hearing is affected, a lot of times that's related to low blood pressure. And so actually having them lay down or go in like a horizontal or flat position might actually help alleviate some of those symptoms. And so there's things that you can do to help make the experience a little bit easier for people, especially if there's something happening that's kind of scary. And so, you just kind of use your judgment and its experience and understanding when are things that you should be worried about and what's kind of normal, what's expected.
Yeah. And if people didn't catch the last episode, we really touched on placement points about where to place and where not to place the medicine and what's the safest place and things like that. And again, when you're working with a new practitioner, make sure they give you a test dot. That's really important to see your tolerance to the medicine and how it's working for you, but they don't want to just slap on 7 dots. That's not safe. And if you have medical conditions, then they can apply it slowly. You can always put on more dots. And I sometimes think it's better to do 3 dots and to get the full benefit of those peptides and not to suffer, 1000% than to take 4 dots and to suffer the whole way through and maybe never want to do it again. Kambo's not easy, but you don't have to completely suffer to your fullest extent to get the benefits of it. And so it's about developing a relationship. It's about surrendering to the process and just trusting the medicine, trusting your practitioner, trusting your body to receive what it needs to receive.
Yeah, I think the only thing I'll add to that is that just because you have a difficult combo session doesn't mean you had a better combo session than someone else who maybe doesn't have such an extreme reaction to it. And so there's a subtlety to the way this medicine works. We're really using it to kind of reset and to help kind of regulate things that our body normally knows how to do. And so it's just getting the body to work better, more efficiently, optimally. And so that can happen even in something that's a subtle experience. It doesn't have to be the big, I purged a ton, I had tons of pain, I passed out. Like, it's bigger is not better. And so there's something around like the demystifying that, oh, you had a really intense combo experience. That means it worked for you and didn't work for the person who maybe didn't purge or didn't have any of these big reactions. And so it's a medicine, and I think it affects everybody differently. And it's not something that has to be extreme to work.
Yeah. Yeah. But it's hard. It's not easy. It's a warrior medicine. It's called a warrior medicine for good reason. It's not an easy medicine. Yeah.
Yeah. But it's beautiful. And I think all the health effects are definitely worth the 20, 30 minutes of discomfort that you go through. And I think the more you sit with it and the more you kind of work with it, understand it, the more you begin to appreciate what it actually does for you.
Yeah. Yeah. All right, Adam. Well, thank you. If people are in Colorado, they can come to either one of us for a combo session. And if you missed the last 2 episodes, check those out because those have some gems in them. But until we see you next time, thank you. Thank you for listening to the Connected Community Podcast. If you enjoyed today's episode, please like, share, and subscribe. I can be found at www.nikkiyoga.com, NICKYYYOGA.com. Until I see you again next week, I hope you have a beautiful day.